Hello, Dr. Miaken Zeigler of Zeigler Chiropractic. Welcome to our workshop, Spinal Hygiene. And typically in our spinal hygiene workshops, we really look at the importance of healthy posture, movements and exercises you can do for healthy input into a spine and ultimately into a brain nervous system. Today, I want to look at it through a different lens, looking at, do you know your numbers as it relates to your longevity and your vitality? And what does that mean, knowing your numbers? Well, the American Heart Association, they like to tell us, do you know your numbers? Meaning, do you know what your blood pressure is, your blood cholesterol, your blood glucose, and your weight? If you know those, then you probably have a pretty good idea of a report card in terms of your heart health. Well, do you know your numbers in terms of a report card for your spinal and brain health? That's what we're going to cover today. If you ask the average person, what is health? What does it mean if you are healthy? Most people will say, I'm healthy because I feel good. But guess what? We experience a lot of breakdown and a lot of other symptoms outside of how we feel long before that feeling occurs. And so knowing your numbers in terms of your spinal health, I think is really valuable to really assess how you're doing as it relates to your longevity, right? You can gauge the track you're on and what it looks like 5, 10, 20 years from now. If you're doing pretty good and you're consistent with it today, guess what? The future is looking a lot different. And then I just want to cover a few fitness assessments that you can do. Most of these fitness assessments were research studies that were done on our middle-aged and older population. But if you can do them now and you're continuing to do them in 20, 30 years from now, again, your future looks a little different. So let's get into it. So knowing your numbers. Let's start with posture. Now, all of these knowing your numbers are things that we have gone through with your chiropractic exam, with your re-examinations to really evaluate how you're doing in terms of your self-care. So when it comes to posture, posture is a window into your spine, right? If you've got postural distortions, that means that you likely have structural or spinal distortions. Now, keep in mind, your brain is always going to want to keep your eyes level to the horizon, okay? So it will compensate and create compensatory factors in your posture and ultimately your spine, as long as these eyes are level to the horizon. So when we see faulty posture or unhealthy posture, it indicates an unhealthy spine and ultimately an unhealthy brain. But good posture is simple and eloquent by design in form and function. The body is designed to have the head, your rib cage, your pelvis perfectly balanced upon one another in both the front view and the side view. If your posture deviates from normal, then the spine is also deviated from normal healthy position. An abnormal posture has been associated with development and progression of spinal conditions and injuries. And I've listed all of those right here. We see increased muscle activity. So we see muscle spasm, restriction, tightness, disc injury, scoliosis, working and lifting, sports injuries. Then we, of course, get the back pain, neck pain, headaches, carpal tunnel, shoulder, ankle injuries. All of these things can be related to abnormal posture. So postural abnormalities in adolescent years have also been recognized as one of the sources of pain syndromes and early arthritis in adulthood. So how important do you think posture is, right? I think we all had moms or parents who said, sit up straight. Well, guess what? When you're sitting up straight, all of your organs have the space they need to do what they are meant to do and function well. So we see these structural stresses that show up with abnormal posture, but we can also see impacts with respiration, right? Our ability to breathe. And if our lungs have limited capacity to breathe, how's that relate to our heart, right? There was one study that showed if in our older population, if you had an increased kyphosis, so an increased curve through your thoracic spine, you're really rounded, that leaves you 144% more likely to die if you are inflicted with a respiratory condition like bronchitis, pneumonia, COPD, we'll say coronavirus, because that impacted our breath and our ability to breathe too. So posture is really important, and that's why we evaluate it every time you get a re-exam on your initial visit, and we talk about how important spinal hygiene is to your day-to-day life, because what you do consistently impacts your health. So posture, know your numbers. What is your posture? What are you working to? And how can you continually support healthier structure and healthier posture on a daily basis? Next, know your numbers. So X-ray. Now, we take X-rays in our office because it helps us really grade and gauge your levels of deterioration, arthritis, subluxation, and how the stress of life has impacted you over your years or decades of life. Okay. Typically, I've got my phases of degeneration, and if you've tuned into my arthritis workshop, you've seen this before, but I've got my phases of degeneration right here in front of you. By the time you reach phase 1 degeneration, it's typically been around for 10 years, okay? By the time you reach phase 2, they're saying 20. By the time phase 3, researchers estimate around 30 years. Phase 1, we don't feel any pain typically. And phase 1 is the only phase considered to be reversible. Okay, so once you pass phase 1, you get into irreversible changes structurally. This is damage and stress to a spine, which impacts how your brain processes your world and manages stress. So typically, X-rays will help us, again, evaluate where you're falling in terms of normal, healthy textbook spine versus phases of degeneration. And it'll give us an indicator of the length of time it's going to take for healing to take place. And it also helps us better provide spinal hygiene exercises and rehabilitative measures to help your spine and structure take on as healthy alignment as possible, and that equates to healthy function. So again, it takes years and decades to go through these phases of degenerative changes. It takes years and decades of healing, right? Again, going back to what I shared with you about posture. Postural abnormalities in adolescent years have been recognized as one of the sources of pain and early arthritis in adulthood. That's one of the reasons children should be getting checked, because you grow a healthy child into a healthy adult, the likelihood of them showing signs of degeneration at 20, 30, 40 are much less likely, as opposed to somebody who comes in at 30, 40, 50, never done any work to their structure, and we're starting off with phase 2, phase 3 degeneration. It's a different foundation. X-rays, again, we brush our teeth. We're taught to brush our teeth at a very young age. I just had a baby. She's 6 months next week. And what does the dentist tell me? You need to be taking a washcloth and running your hands along those gums. When teeth come up, you need to be cleaning those teeth on a regular basis. What do we ever learn about our spine? Not much. And most of the time we learn about it when we're in pain or we're already down the road. So X-rays are a great way to, again, know your numbers in terms of how life is impacting your health and stress. So what do we also do in the office is X-rays are a static measurement. Your core score, which is made up of your heart rate variability or HRV, your surface EMG, and your thermal scan. These are a dynamic measurement in terms of how well your body is managing and responding to stress. So heart rate variability, this helps me determine your overall ability to adapt to your environment. And it does this by looking at the timing of your pulse and determining the balance and tension within your nervous system, okay? Stressful lifestyle habits include poor dietary choices, limited exercise, constant emotional aggravation can cause the body to be caught up in a fight or flight response, which can lead to exhaustion and a draining a person's reserve. So a reserve, think about it this way. If you have a reserve column that's pretty high, right? Stress can go up and down and it's no big deal because you're able to respond and adapt appropriately to the stress. It becomes a problem when our reserve drops down and we see an increased stress. This is where we start to see breakdown, poor adaptability, poor reserve, and we start to see dominance in terms of how our nervous system is responding. So that's where we can see people who get stuck into a fight or flight response where it doesn't matter what the stress is, they are responding like, it is emergency situation, okay? And that can be really trying and stressful because when we have a fight or flight response, our body is secreting cortisol to respond to that. What happens with cortisol, right? Our heart rate increases, our blood starts to shift from our vital organs to our extremities to power our muscles. We get dilation in our eyes because we are ready to run or fight, okay? This was really great when it was survival mode, when we were caveman, right? Because we had actual dangers out there that would be life or death situations. We don't typically have that now. And so if we're responding in a dominant autonomic nervous system where it puts us into fight or flight, this really impacts how we manage stress and ultimately our healing. So heart rate variability is really great to evaluate and know where you are in terms of function and managing and responding to stress. If you remember, we want you in that green box right along that black line. That tells us really healthy, good function. If you're outside of that, if that white dot charts far to the left, far to the right, or down, again, it tells us a nervous system that is not adapting appropriately, and it's impacting our ability to, resiliency to our everyday environment. So surface EMG, surface electromyography. This is looking at the function of the muscles that support and move your spine. Now, these muscles are controlled by the nerves running within it. So this test measures how much energy is needed to maintain your posture and how it is distributed throughout the muscles. If there's too much energy used when a spine is out of balance, this score will be lower than normal, okay? Over time, daily stress can continue to overwork these muscles, causing them to lose their support and mobility. This will also lower a score. Muscle fatigue and poor energy distribution are signs of a person's entire health being under stress. So by precisely measuring muscle activity, we are able to measure and follow how your spine releases tension and for you to regain more control. So again, this is looking at energy and efficiency and also allowing us to identify any neuromuscular patterns. So you guys have seen your scores here. This black line is the pattern of your spine. The white line right here is where we want that pattern to be. If you've got really healthy pattern, that means that you've got healthy efficiency of the neuromuscular layer. You've got appropriate movement and posture structurally. If you don't, then again, it tells us, you can see how this person's pattern is really shifting into the spine. Very little activation through here. Whereas we get up through here, tons of activation, because getting outside this gray line, there's green, blue, and red, mild, moderate, severe stress. So again, it gives us an idea of where you're holding stress, where a lot of that energy and tone is carried, and where there will be abnormalities as it relates to subluxation in your spine. So again, surface EMG is a great way to evaluate how you're doing in terms of your health. Now, this deepest layer, this is a thermal scan. So this is a temperature scan, and this is measuring temperature to 0.3 of a degree on the left and the right side of your spine. And this is measuring organ and gland control. So it's assessing the part of your nervous system that helps control your organs, glands, and blood vessels. Now, your autonomic nervous system works alongside your spinal nerves to regulate your immunity while also managing your internal organ function. So by precisely measuring your temperature, it allows us to see if there's stress that's built up and how deeply your bodily functions are impacted. So each organ system relies on clear, balanced nerve signals to work efficiently. Nerve interference that is detected by the sensor is valuable in understanding and helping us plan health and wellness strategies. So again, if we look at this person's scan, Okay, clear bars are what we want, or white bars. We want activity on both sides of the spine. Okay, this is actually a pre and post scan. So this is somebody when they first came in. Green is mild stress, blue is moderate, red is severe. So when we see this deepest layer impacted here, this person is under significant stress. Their organ function is under stress and may be impacting how they're regulating immune function. And so this is post scan where this person's been getting adjusted, and you can see how it's clearing up. Now you can also see how we might potentially see a pattern here, right? We see the stacking on the left crosses over to the right. So we have stacking on the left, crosses over to the right. Looks different, but again, when we start stacking multiple scans together, we start to see, is this person holding a pattern? And when you have patterns that show up, it gives you an idea if your body and nervous system may be resistant to any change. So again, that goes back to length of time and work that may be required to change how your brain and nervous system have been responding to stress since you existed. Okay, so again, another great measurement to know your numbers. Now, spinal movement. Spinal movement is so important. Okay, some people say, oh yeah, I've always had tight hamstrings. Well, guess what? Spinal movement tells us how flexible your spine is, and it also tells, in terms of your range of motion, how your spine is moving. Again, when you have proper movement into a spine, that's movement is life, but that proper movement is input into the brain, okay? And the brain is better able to process your environment. If you have bad movement or lack of movement, that instantaneously starts to create joint damage. So when you have proper movement, and you always have proper movement, you can maintain healthy joints. So these are the normal ranges of motion for cervical range of motion. Bending left and right or lateral flexion should be 45 degrees. Flexing forward or extending back or rotating. You should be nearly able to bring your chin to your shoulder. So if you're not able to look fully, almost behind your shoulder or bending by 45 degrees, it gives you an idea of where the stress is showing up structurally. And we take that to another layer. If there is lack of movement, could we potentially see degenerative changes going on? So what does your X-ray look like? And if you've got poor movement or lack of movement, how is the brain processing things? And ultimately, how is it able to manage and adapt to stress, right? All of these pieces build on top of the next. And you didn't start off with being arthritic, right? But you started off with having poor posture as a child. And over time, we start to see you lose movement in your ranges of motion, whether in your lumbar or your cervical. And over time, that's when we start to see poor resiliency. So we start to see somebody who gets sick often, and length of time that they're sick lasts a long period of time. They have low energy, poor sleep. Now we're starting to see brain nervous system stuck into more of a fight or flight. And what does that look like X-ray wise, right? These all build on each other. So know your numbers in terms of what healthy outcomes are for your spinal hygiene. Next, balance. So proprioception, it is your brain's ability to understand where your body is in space. Oftentimes it is called the sixth sense, right? My hand, I know it is behind me right now, not because I can see it or feel it or smell it or taste it. I just know. And that is where proprioception is your brain's ability to know where you are in space, okay? And so eyes are a big portion of our brain, being able to understand and give feedback to where we are in space. We have a ton of proprioceptive receptors at the bottoms of our feet and in every joint of our body. Lots in our feet, lots in our ankles, knees, joints, tons in our spine, and especially tons at the top of our cervical spine. So again, goes back to how is the movement, right? And how does that influence how our brain is processing our environment? So, I mean, one of the things as we age, we know that if somebody falls and breaks a hip, it starts a downward spiral of other interventions that need to take place before somebody passes. So for me, I'm looking at How is somebody moving? How are they walking? Are they sure-footed? Do they have appropriate proprioception so they can maintain their balance? And if we have that down the road, your health outcomes are a lot different. So that's also something we look at in terms of your function in our office. So dynamometer, this is grip strength. Okay, we do this because we want to look at what is the health of your cervical spine, right? The nerves that are exiting out of your cervical spine, these flow to activate muscles of the forearm and the hands and correspond to grip strength. So if there's anything going on here, this is a hierarchy here. There could be something here, could be something here, could be something here, here. This is hierarchy. So if there's anything going on here, it can affect end organ function. So we find that if we have lower grip strength than what is appropriate for your age and being a man or a woman, that can give us a health marker in terms of where the stress is. But they've actually done studies. So it is a frailty marker for folks who are older age. An 11-pound decrease in grip strength is linked to 16% higher risk of dying from any cause, including heart disease, stroke, and heart attack. So we do dynamometer testing in our office, and we are measuring, are we seeing change? But certainly when we're looking at our older population, we want to keep track of this. Okay, so we wrapped up really knowing your numbers in terms of your spinal hygiene health. This is why we do this at re-exams, because we want to evaluate what we're doing in the office. Is it supporting improved function, right? Do I need to change my technique? Do I need to change my recommendations for you? Is your body prepared and ready to graduate to a different frequency? Would you benefit from adding in, another modality? Is your brain and body more receptive to take on a massage to help with healthier, more balanced patterns? We talk about anti-inflammatory foods. We talk about breath work. We talk about lots of different things, but these, I would say, are the core pieces that we are looking at and evaluating to assess your response to care and your movement towards health and vitality and bigger picture longevity, right? Because my goal with everyone is that if you are understanding the importance of your spine and you have this background, my goal is that you are choosing to take care of your spine differently for the rest of your life, right? We're all taking care of our spine. It's just, are we intentional with it? So these last couple. So this is actually a fitness assessment. I liked these. I mean, we know movement is life, but there's actually been some research showing the importance of movement and our walking speed, our ability to do push-ups, or another test to really evaluate our longevity. So first of all, what is recommended by the U.S. Department of Human Health Services for physical activity is that we should be doing 30 minutes a day. And again, you don't need to think about this as I need to go to the gym every day. No, you can do short bouts of energy doing your hobbies or taking the stairs or parking at the furthest spot at the grocery store lot, right? Gardening, riding your bike, right? We can do different movements and activities that can add up to 30 minutes. Okay, so movement is key, 30 minutes a day. And the guidelines for physical activity for adults 65 and older is they should be a minimum 150 to 300 minutes every week. And what's recommended is a combination of balance, aerobic, and muscle strengthening exercises. Okay, so this is, again, an assessment for you. Where are your numbers? How much movement are you getting in a day? And I will challenge you that I didn't even write in this PowerPoint. How much movement are you getting and how much are you sitting? Because sitting, this could have been added, but sitting is, and especially cumulative sitting, is really impactful and stressful to your brain and your spine. And it's linked to higher mortality rates. So movement is vital. So walking speed, I liked this. Walking speed is actually been shown to be the 6th vital sign. and it helps us provide insight to lifespan. So in a 2011 study published in the Journal of the American Medical Association, found that people's ages 65 and older who could walk 1 meter per second or faster lived longer than those who didn't. And another study out of the British Journal of Sports Medicine concluded that walking at a faster than average pace reduced the risk of death from cardiovascular disease by 53% for all people 60 and older. So just walking, that's the normal speeds, 1.2 to 1.4, but walking faster than the normal speed, so walking at a faster pace, reduced your chance of cardiovascular disease by 50%. That's pretty significant. So I go back to the movement. How can you walk more every day, get more movement and walking, and how can you walk at a faster pace? Push-ups. So there was a study out of the American Medical Association that measured the health data and push-up capacity of 1,104 middle-aged active male firefighters over a span of 10 years. The men who could complete 40 push-ups during the 10 years had a 96% lower risk of cardiovascular disease than those who could do fewer than 10 push-ups. Now, I don't know what the correlation is to women, but what we do know is that, again, looking at muscle strength, movement, ability to coordinate, and have good cardiovascular health and rock out 40 push-ups, man, your health and life expectancy is significantly more than those who could do 10 or less, right? So these are easy things that we can measure. Maybe you're not 50 or 60 and older right now, but are you doing the things that allow your body in the future at 50, 60, 70 to be able to do these things? You're building health now, right? Last one. So this is the sitting, rising exercise, okay? Now, the sitting to rising exercise was a study done back in 2012, and they wanted to predict mortality in middle-aged and older people. They said this test was devised to evaluate that. But it is well known that aerobic fitness is strongly related to survival. Their study also shows that maintaining high levels of flexibility, muscle strength, power to body weight ratio, and coordination are not only good for performing daily activities, but have a favorable influence on life expectancy. So this is the sitting to rising test. And the test requires you to lower yourself to the floor, crisscross style, without bracing yourself with your hands or knees, arms, or sides of your legs. And if you can stand back up again without the aid of those body parts, then you've scored a perfect 10. Okay? So you lose a point every time you have to support yourself with a forbidden joint or appendage. So understand, this research was done on adults 51 to 80 years old, and they followed them until a participant died or until a study concluded, which was around 6.3 years as far as the median. And what they found was 159 people died, only 2 of whom had scores of a perfect 10. Those who had the lowest score of 0 to 3 points had a risk of death that was 5 to 6 times higher than those who scored 8 points. So I think this is a great exercise for you to do right now to evaluate where you are. And I'm thinking, can my mom or dad or grandparents do this test? And if they can't do this test, or they score a 0 to 3, they're 5 to 6 times more likely to die in a time frame of 6-7 years than those who score an 8 to 10. So what am I going back to? Because even as I was reading about that study, again, it went back to movement, coordination, flexibility, strength. And what are we measuring every time you're here being evaluated for your chiropractic care? We're measuring those things. And what does that mean? That means that you who are getting chiropractic care are healthier than the average person. Not only that, but you're building a foundation of health for years and decades to come. And if you choose to continue to do the work, to invest in yourself, and to know your numbers in terms of spinal health and hygiene, then guess what? 20, 30, 40 years from now, life looks a lot different for you than it does for the average person who is not doing the work. And so that's where I'm closing today, because I love to be in connection with you. I love to support you in your health journey. Everything you are doing and I am recommending for you, I am doing too. I am working on it just as much as you are. Having a newborn baby, I'm telling you, my daughter has pulled me forward because I am used to holding her and nursing her and carrying her. So I have to be that much more cognizant of my movement to hold myself back in my spinal hygiene exercises and my postural interruptions and the work that I do to support healthy curves. I'm doing the things. And I also know my numbers because I want them to begin to at least stay the same, if not continue every year I age. So I love connecting with you and I appreciate your choice to show up in our office every week to do the things that support health and vitality of a spine, of a brain, of all the things. And who do you know that needs to know the same things? Who do you know that is needing connection, is needing to hear these things so that they can be healthier 10, 20, 30 years from now? They can do the things that they love to do with the people they love. So please share this workshop. Please bring somebody into your next appointment. Please refer into our office because we know the people who are getting chiropractic care are healthier. They're experiencing the world differently and they are enjoying the people that they love much more. So I appreciate you. Thank you for being here. Please like and subscribe to our page so you get updates whenever we do post new workshops, and share what you know. So I look forward to seeing you in the office. I love and appreciate you. And again, Dr. Miaken Zeigler of Zeigler Chiropractic. Take care.